I was asked by someone what is the actual difference between a doctor and a physician associate. And I wanted to tell them to watch all the videos on my channel, but I said, alright, let's make a single video where we tackle this. The first difference is really the training. The bros normally have a 5-year course, some 6, and then we physician associates normally have a 2-year course. The interesting thing is with the undergrad physician associates, because the argument normally made towards us is that in 2 years we cannot possibly cram in the whole of medicine, which is true, it's a lot. But if these undergrad peers have 4 years, the question then comes, would they be able to go in the deeper level than their colleagues that did the 2 years masters? We do know graduate medicine exists, and these people are not doing 5 years or 6 years. They are doing 4 years, and there's a lot packed in, and when they come out, they are deemed as doctors. If these undergraduate PAs have 4 years, could they be like the graduate doctors? Unless the curriculum is completely different. But then again, it's most likely going to be, if you look at the changes that the GMC plans to make, the new curriculum framework they put out recently. As physician associates, regardless of you doing a 2 years master's course, 4 years undergrad, you have a limited scope of practice. Medicine is big. Your training does not allow you to express yourself in the full expanse of medicine compared to our bros, because that's what their training allows them to do. The whole of medicine is opened up to them. They practice independently. They don't require someone supervising in order for them to practice. You as a physician associate, you are not independent, because the patients you are seeing are not your patients. They've only been delegated to you because whoever is supervising you deems you competent. Because the patient is not yours, the ultimate responsibility falls on the doctor. You think patient A has problem Q and should be given medication X. If doc thinks patient A has problem Q but should go with medication Z, we go with Z. Your opinion at that point as a PA doesn't really matter. Doc can engage you and try to explain to you why he or she thinks it is Z. But at the end of the day, what the doctor wants is what is going to be done. Currently, physician associates cannot prescribe no order ionizing radiations, but with regulation coming, check the other videos, these things will be addressed in the future. Doctors do not have this problem. They can order ionizing radiations and they can also prescribe. A doctor finishes medical school. They go into their foundation year, F1, F2, get the training number, CT1, CT2, CT3. They work their way and boom, they become consultants. Takes a long time. Within the traditional medical setting, there is a clear career progression. You know where you are going to go year after year. Within the physician associate world, there is nothing of that sort. You could have been a physician associate since the time Jesus Christ was crucified on the cross. There is nothing distinguishing you from a physician associate that qualified yesterday. If you are someone that likes that kind of structured framework, I go here, then I go here, then I go here, then most likely the physician associate world might not be for you. There is what they call lateral progression. If you've been in a certain specialty for a long time, the people therein most likely do trust you. And of course, they will entrust you with more stuff. But there is no established route of progression. That is one of the things that tends to burn people out and make them seek another path. Go to medical school and your path will be clear. Be you a doctor or be you a physician associate, we all do burnout. I've read several posts from physician associates that have been working over 10 years, some in the United States, some in the UK. And I've read similar posts from doctors as well in the UK and abroad. The same thing that pisses one off pisses the other off. Everybody is tired of administration, check boxes, e-learning this, e-learning that, quip this, audit that. Nobody really cares about them. And evidence does show that these things burn people out and make their job very, very much unenjoyable. Physician associates tend to be content with their salary. We definitely get paid more than them initially when we start our career. Then at the end, things take a different turn when they start earning the big dough. But within the UK, doctors are not happy with their salary, and you can't blame them. If you look at what the bros are getting over there in the USA and the champ change they are getting here, they feel they've been handed a raw deal. Hopefully they get some success with their full pay restoration, else they'll be bitter. And you know, when they are bitter, the back and forth between ourselves and them is not going to end. I just want them to be happy so they can enjoy their job, we enjoy ours, and everybody just lives peacefully. Anyway, this was just a short one. It's your boy Yoti, and I'm out. Salute.